Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Carrie Atcheson. She's an anesthesiologist and co-founder of Business Mindset MD. Today's Kevin MD article is How Do We Get a Critical Mass of Women Physician Innovators? Carrie, welcome to the show.
Thank you so much, Kevin. I appreciate the opportunity.
So let's start by briefly sharing your story and journey.
Sure thing. So, as you said, I'm an anesthesiologist. I'm currently at the University of Alabama at Birmingham, and I'm a working wife and mom, and just in my heart, a gender equity advocate. If you knew one thing about me today, you'd know that I got to spend the morning advocating for female physicians at the state level. I'm here in Montgomery, Alabama today, which is our state capital. And I also I was sharing a little bit with you before we started, I just had the opportunity to meet the Reverend Jesse Jackson because he was here today, having celebrated Juneteenth here in Montgomery. And if anybody ever wants to come for sort of a historical event that you will never forget, come on down here to Alabama and Montgomery for the Juneteenth celebration. Just a beautiful mix of history and culture, and the Equal Justice Initiative really does it up right here. But he said something that I think kind of pertains to our conversation today. One of the other folks who was attending the celebration said to him, I've been doing this work for 50 years. And he said, well, what are you doing today?
Mm-hmm.
And so that question of like, okay, so things are done, you got things planned, but what are you doing today? Just, I don't know, it just was really powerful for me. So that's what I'd share with you today.
What about your advocacy efforts? Tell me some of the challenges that you're advocating to overcome as it relates to women physicians.
That's such a great question. So, here in Alabama, we are about 25% of physicians. And so, we're facing a recruitment challenge getting physicians to come and be physicians here, serve here. And we're facing an additional challenge of recruiting physicians to rural areas. So, things that we look at are, how to make conditions optimal for physicians to practice in rural areas, how to expand Medicaid so that our rural hospitals can survive and pay their physicians, and also how to support, especially early and mid-career physicians as they are trying to launch their careers here. And so those are some of the biggest challenges that we face. And then there's the additional layer of legislative challenges. We were surprised, not surprised, to have State Bill 129 passed this year that essentially made it against state policy for a state-run institution to have a diversity, equity, and inclusion program. And so we are figuring out how to do the work of creating great workplaces and great teams, sort of without the usual tools. And so that's part of our challenge.
How did you get involved with physician advocacy? And maybe for those physicians who may be listening to you today, how can they get involved?
Oh, yeah, absolutely. So I think that getting involved with your state medical association or your state specialty board is a fantastic place to start. I've been involved with with organizations in every state I've been in, from New York to Oregon to here, and I have gotten an incredible amount of collaboration, mentorship, opportunities, and just connection to what's going on in my community and my state from that involvement. And so that's sort of my entree into advocacy work. And it's where I'm continuing to put my efforts.
All right, let's talk about your Kevin MD article. How do we get a critical mass of women physician innovators? For those that didn't get a chance to read your article, tell us what it's about.
Absolutely. So I'm kind of a business nerd. So I kind of watch Silicon Valley and Wall Street with similar interest and analysis to the way people sort of watch gowns at the Met
Mhm.
Gala, I think. So when Fortune magazine came out with a piece about the vertical integration in UnitedHealth Care and in CVS and the other companies that are sort of creating their own chain of insurance clinics, pharmacies,
Right.
ancillary services. And when they featured the two female CEOs, I was really fascinated. And really wanted to ask that question of what does this mean for us as physicians?
Hmm.
And I think if we're listening really carefully, it means opportunity for us. I talked a little bit in the article about health IT, and I just learned yesterday that UAB has created a Master of Science in Artificial Intelligence degree, one of the
Mm.
first in the country. And so I'm really excited about the physician scientists. They're going to be coming out of these programs. There are problems to solve, and we are really good problem solvers.
So you mentioned at the beginning the phenomenon of vertical integrations. Like you have these, you have these CVSs, pharmaceutical companies, you have health insurance companies, they're getting into the clinical space. So you mentioned that there are opportunities for physicians. What are some of those opportunities?
Oh, so I really think that there is always an opportunity for physicians to build something.
Yeah.
So I think that we see the problems and the opportunities in not only in clinical situations, but also in business situations and in operations situations. We see the problems very clearly. And so I think if we can start thinking clearly about the solutions, then we can create things that solve some of these problems. And what was really interesting to me is that United Healthcare and CVS are finding those physicians who are creating, practices, micro practices, local practices that are solving those problems, that are, creating, bridge programs for assisted living. They're creating population specific clinics that are sort of, concentrated on serving one particular population, for example, people with diabetes. And they are, they're buying them or funding them. And so they're seeing us creating those solutions.
So can you give us an example of where a physician perhaps got involved with one of these entities that's not a traditional medical practice, and what will be a hypothetical or even a real world example or story where they move the needle?
Yeah, absolutely. So I actually think of a colleague of mine, Dr. Brittany Anderson. So she is a family physician who practices here in Alabama in Demopolis. And she started her own primary care, direct primary care in the town when, near where she grew up.
Yeah.
And she is sort of deeply serving this community with sort of wraparound services that they don't always get access to, and also kind of trying to create not only a service or the person to call when you need a physical or you need to go get your mammogram, but it's also a person who helps you sort of create wellness. So that opportunity to create community wellness, I think, is there, and it's there for each of us in a really unique way that only we can do based on who we are and where we came from.
I talk to a lot of physicians, as you could imagine, on this podcast, and they write on Kevin MD. And there is a lot of, to be frank, complaining certainly about the state of medicine today. So tell us why it's important for these physicians to engage in some of these innovative ideas, to be outside the box and try to solve these problems directly that they may not necessarily be exposed to in a traditional medical setting.
Yeah. Eh, I think that first of all, I totally get it. Like there's something about, us as physicians and our medical training that like it's like, sharks can't breathe if they're not moving. Like we
Hmm.
can't breathe if we're not complaining.
Hmm.
But taking that complaining and uh, you know, operationalizing it, making it into data, and then using it productively to solve a problem. Like that's the other side of the coin of complaining is taking that problem you're complaining about and figuring out how to solve it. And I think that the reason that we need to do that as physicians is not just because it makes the world a better place. That is very true and a laudable goal, but it's also because it makes us happier. Like if we are solving a problem, if we are sort of fulfilling something that only we can do, it gives us joy and it gives us passion, it gets us out of bed in the morning. And so I think there's an altruistic reason, and we're all sort of at heart altruists coming into this field. But there's also a self-based reason where like it makes your days better
Hmm.
when you're solving problems.
So you have that perspective of a business mindset. You're literally the co-founder of a site called Business Mindset MD. Not every physician sees things through that lens, however. So there's always that perception that physicians are terrible at business, and how can we be involved from a business aspect to take advantage of some of these opportunities that you mentioned.
It's such a great question. And I think the answer is, we really live in the internet age, and we also live in the age where most specialized information is a phone call, a direct message, or an internet search away. So, if you see a problem in your community that you feel like needs fixing, if you want to start a business, the Small Business Association is out there for you. Your state, medical society is out there for you. There's, dozens of physicians who already own practices who would love to talk to you about their stories and their foibles. And, there are groups like our group, Business Mindset MD, who offer that kind of education. So, we're doing a panel next month on choosing EMRs so that people who are going to be making that decision can learn from people who already made that decision. So that expertise exists within our community, and you just kind of have to reach out for it to the places that already exist.
What about your colleagues? Do you find that your colleagues are interested as you are in terms of these business aspects, or do you find that some physicians may they say, "I just want to take care of patients, and I just want to leave the business to someone else, and that's not something that I really want to be bothered with." What's the environment like among the physicians that you interact with?
Yeah, I feel like yes, absolutely. There's always going to be that diversity of perspectives, and honestly, like we need each other,
Hmm.
right? So, we need people who are very service minded and who want to come to work and take care of patients, and we need people who are very business minded and want to, have meetings and solve problems. And, we need people who want to, in my industry, and we need people who want to run our pre-op clinic, who want to wrestle these interesting these interesting problems that complex patients have. So I think my answer is the team, right? Like we all have different perspectives, and if we can all figure out how to get everybody's perspective functioning in the right way so that they can be a good part of the team, then we're all winning.
So if physicians are interested into getting into that physician innovator space, where can they start getting that information? You mentioned podcasts and the internet. Do they need to get an MBA degree? So tell us some first steps that they could start with if they want to get into that space.
I love this question because I think as physicians, we tend so deeply to overtrain ourselves.
Hmm.
So you absolutely can get an MBA, and an MBA is going to give you not only some of the know-how that you're going to need, but it's going to give you a network that you can lean back on. And I think that's one of the biggest assets of any kind of program that you're going to do is it's going to give you a network. So I think if you're evaluating a program, whether it's an MBA, a Master's of Public Health and Health Policy and Administration, which is what I did, a master MPA, a Master of Policy and Administration or Public Administration, or some other graduate degree, or any sort of private program like Business Mindset MD or another coaching program, you want to also evaluate what kind of network it's going to give you, what kind of support it's going to give you going forward, because the people who you're going to encounter in that program, they're going to be your colleagues and your mentors going forward. So it's not just about that, year, 2 years, 3 years that you're completing that program. It's about what kind of network and mentors it's giving you going forward. But I think the best place to start is actually free courses. So there's so many free courses on the internet. Um, I really like Arlen Hamilton's courses that she does. And for those of you who don't know, she's a venture capital, is sort of a first generation wealth. She came up with very little and has built a network that's very inclusive and concentrates on businesses funding businesses of women of color, people of color, and women. And so she teaches some business courses that are, on her YouTube channel, and I think that's a
Mm.
great place to start.
You mentioned the importance of the network and how that could be as important as the education itself. So, give us an example or a story of how that network helped a particular physician really make a difference in the innovator space. So, what would that look like in real life?
Ooh, that's such a good question. I think that I will use a personal story. So, my college roommate, we happened to go to medical school together. And she, we ended up overlapping on the West Coast at one point. We've always stayed in touch. And as she had transitioned out of corporate medicine, clinical practice, academics, and was looking to transition into direct primary care. And when this was happening, we sort of realized like, oh, hey, we are moving through some of the same spaces right now. We're talking about some of the same things. We're, building our businesses together. And so we ended up as accountability partners. So we would meet and make sure that we were both doing all the things that we needed to do. We'd brainstorm about what the next thing to do was. And, we're still meeting 3 years later. So I
Good.
think
Mhm,
that
go ahead.
kind of gives you an example of how those networks, you never know how you're going to re-encounter folks.
We're talking to Carrie Atcheson. She is an anesthesiologist and co-founder of Business Mindset MD. Today's Kevin MD article is How Do We Get a Critical Mass of Women Physician Innovators? Carrie, will end with some of your take-home messages that you want to leave with the Kevin MD audience.
Thank you so much. I'm so glad we all got to talk today, and it's really nice to meet you. I think that what I really want more than anything is for people to stay in medicine.
Mhm.
And so whatever we have to do, whether it is taking a sabbatical, taking a break, reorganizing our lives, reaching out for support, reaching out to our networks, I hope that we make that reach. I hope that we make that ask because people want to help us, they want us to succeed, and our success serves communities. Our success makes people healthier. So I really want us to stay in medicine, and whatever we need to do that, I hope we can do.
Carrie, thank you so much for sharing your stories, perspective, and insight. Thanks again for coming on the show.
Absolutely. Thank you.